I get to ride horses, I get to do veterinary medicine, I get to improve horses' quality of life. This is what I want to do when I grow up.
Welcome to Doctors Without Borders, the official podcast from the MSU College of Veterinary Medicine. In this episode, we're joined by Dr. Jane Manfredi, an associate professor and the Marianne McPhail Dressage Chair in Equine Sports Medicine, and Brooke Boger, a DVM-PhD dual degree program student who is Dr. Manfredi's PhD student in her lab. Together, they represent the power of translational research, mentorship, and the innovative spirit that drives veterinary medicine forward. Doctors Manfredi and Boger, welcome to the program.
Thank you.
Thank you.
So to start us off, I'd like you each to tell our listeners, what drew you to veterinary medicine?
When I was younger, my mom had a passion for riding horses, and she shared that passion with me. And so when I was younger, I would ride. I was part of the United States Pony Club. And as part of that program, they really emphasized like whole health care. So from riding to looking at veterinary medicine to managing how your horses were on the farm. And so really that got me very interested. I loved hearing the veterinarians talk and seeing what they did and how they could help our horses. And so I did have a pony at the time who unfortunately had an endocrine disease, which caused her to have some pain in her feet, which she was unfortunately not able to kind of recover from. And so really that has been a pivotal moment where I wanted to become a veterinarian, and I wanted to look at how we can help ponies and horses that develop laminitis to prevent it from happening and to help them recover better. So really those kind of pivotal moments with my pony and my time with my mom and Pony Club really helped draw me to veterinary medicine.
For me, I think I wanted to be a vet since probably before I could walk. I was obsessed with animals. We had dogs and cats growing up, and I just loved them. And my parents were like, if you love animals so much, you could be a vet. And it just stuck. I was like, okay, I will be a vet. And then as I got older, I always wanted to come to all of our veterinary appointments, and I just stared at our vet in awe when he was able to help treat our animals and make them feel better. And I think the most pivotal moment for me was when my dog was hit by a snowmobile, and we went in, and he had a broken leg, and I remember being so worried about him, and they were able to fix him, and coming to all the progression of the appointments and seeing him be able to go from three-legged limping to fully recovering and running around totally fine. That was really what solidified it for me. I was like, that is what I want to do. I want to help them feel better. I want to change these owners' lives. That is just amazing. And so ever since then, I just stuck with it. And then I got into horses, and I got to meet the equine vets, who I thought were even cooler. It's like, you guys get to go onto the farms and deal with these amazing creatures. And yeah, I just never considered another career after that. So Dr. Manfredi, can you discuss your role as a veterinary researcher and professor?
So I have the best job in the world. So I get to do veterinary research. I got to directly help horses on clinics. I get to mentor amazing students like you and teach more and many more veterinary students as well. So I'd like to see my day as kind of a teeter-totter that balances back and forth between doing things with research, with teaching, and helping clients and their animals. The awesome things are, that with my research, I can really use that to inform how I treat the animals that I'm seeing in front of me. And then I can also pass on that knowledge to students as they go out. So it kind of helps my research and our research, I should say, have like an exponential effect. So, by one little thing, we have a little ripple. It's like a little bit of a butterfly effect where we can affect horses all across the world. So I just think that is like the best thing ever.
So Brooke, when you first got to school, and did you decide you wanted to be a dual degree student before you got here?
So I decided in undergrad, which I was in Michigan State. I was undergrad here. Mostly because Dr. Manfredi was kind of like, have you ever considered this? And I was like, I didn't even know that existed. And after that, I was like, yes, that is what I want to do.
And that is exactly why we're here today, because I want other people to know that this type of thing exists. And I wondered how you met each other.
So we are both part of the Michigan State Dressage Club here on campus. So it's a group that's for undergraduates, and actually graduate students too can join. We both ride dressage, which is kind of like figure skating on horseback. And so Brooke was a student, and then was I already faculty mentor? Or
you were. I think it was your first year.
So I was actually a member when I was a grad student here doing my PhD at Michigan State, and then stayed on to become faculty mentor when I joined faculty. And so I was faculty mentor, and Brooke was in the club, and so she had some interest in research, and we knew each other from that. And wasn't it Melissa Schott?
Yeah, it was Melissa Schott. I needed to do research credits for my undergraduate degree, and I was like, I really want to do it with horses. Like, I don't want to do it with anything else. And I asked Melissa, because I knew she was in a lab here, and she was like, you should consider Dr. Manfredi. Like, she's new, she needs help. And I was like, okay. And I sent her an email, and she said, sure thing, come right in.
That's great. So, Brooke, what was your inspiration to become not only a veterinarian, but a researcher?
Oh, that's a good question. And it kind of comes back to all the things you said before. When I was in high school, I got to shadow with a veterinarian, just like a normal small animal vet. And I shadowed at night, so I didn't get to see some of the cool like surgery procedures during the day, but I saw a lot of his like preventative talks where we talked about flea and tick medication and vaccines. And I think by the second week, I could have given that whole spiel myself. And I found that I was a little maybe bored, or it was a little mundane. I was like, I feel like I'm missing something. Like, there's something I want to be slightly more intellectually stimulating. And then when I came here and I joined your lab, I realized like, oh, research is so cool, and I can take any question that I want to know and I can look into it. And then on top of that, I found that when we worked clinically, we could help the patient in front of us, which was great because that is huge for the owner and that patient. But then I discovered with research that not only could we help the animals right in front of us, but then we could send out this information to the masses and help thousands of horses. And that was really what sold it for me, is not only could I help the ones that I was working on, but I could help other veterinarians work on other creatures and help their lives.
From all the stuff that we have done, many, many different research projects, what has been the most rewarding so far, where you felt you've had the most impact?
So my most rewarding project is what we call the TA study. And so this is when we give horses steroid injections into their joints, and then we follow their blood, insulin, and glucose changes. And we do this because historically clinicians worry about if we inject horses with steroids, they might develop laminitis, which is a very painful condition that can often be fatal. And so we wanted to see if their insulin spikes were high enough that they could potentially cause laminitis. And so we did this study in normal horses, and we were able to publish this research, and it made a huge impact. We were awarded the EVJ Open Award, which was for the most clinically impactful research, and I even got to travel to the UK to accept this reward. So that was hugely impactful, and I think that we've changed a lot of clinicians' views on steroids and when to treat them or when to use them in metabolically normal versus abnormal horses.
Yeah, that's really important, because steroids for horses, all our horses are amazing athletes, even if, from backyard all the way up to the Olympics. So they have to be better athletes than probably yourself or myself. Oh, for sure. And so when they have arthritis, steroids is really a go-to medication for horses as well as humans to treat it. But in our horses that have these problems with the endocrine system where their insulin spikes and can cause that laminitis, for sure, we want to avoid those steroids now. And so that's kind of a really important fundamental question that you were able to answer through your work and shared work for ourselves, as well as other doctors that were involved, such as Amy Colbath and whatnot. So it's really cool to see.
Let me ask a question about insulin spiking and laminitis. So you mentioned that a few times. Does the spike in insulin cause a metabolic disorder?
So the spike of insulin is kind of a definition of the metabolic disorder in the horse. So that insulin spike, so let's explain insulin for a second. So when you eat a jelly donut in the morning, your blood sugar or glucose rises, and then insulin is released from your pancreas to help that glucose get into the tissues for you to be able to use it to move your muscles and work and all those things. So that's a good process. But unfortunately in our horses, it's kind of like a situation where in humans is like type 2 diabetes, where they release too much insulin. And so for some reason, insulin then drives the problem in the horse's foot. Now, whether that's due to the specific receptors there or an increase of that inflammation in the bloodstream that's going down, we haven't elucidated that yet. So that's an ongoing process. But in our horses, it ends up resulting in kind of a bone in their foot, kind of breaking away from that hoof wall, and then, when you're 1,200 pounds and you're now standing on your very tippy toe of a bone, that's really painful.
What was your inspiration to become not only a veterinarian, but also a researcher?
So you heard about my inspiration before with my pony who developed laminitis. And so how I started to think about research is actually kind of a unique thing. So my thought was that I would go out and be an equine clinician. So I would see sports medicine cases in the field and travel on my truck all day, which is amazing and fun. And I did do that for a part of time when I was in California in private practice, which is a very lovely place to be. But in vet school, I was looking for summer jobs and things to do. And so in the summer of my second year, when I was looking for jobs, I should back up and say I did vet school at the Atlantic Veterinary College in UPEI, Canada. So while I was there, I was looking for summer jobs, and I just happened to stumble upon Michigan State University's College of Veterinary Medicine Summer Veterinary Research Program. And I knew that MSU had a really well internationally renowned doctor, Dr. Hillary Clayton, who did a lot of horse research and dressage horse research particularly. And so I said, wouldn't it be great if I could do this program? So I just applied, and the individuals there, I would say Dr. Vilma Yusbastian-Gherkin was actually really pivotal, and I wanted to really call attention to her. She's recently passed, and she really changed my life. She said, why not? Sure, come on down, and was so inviting. And so during that summer, I was able to, as a veterinary student, perform really impactful veterinary research looking at horse welfare with bits, which is a piece of equipment we use to have in the horse's mouth when we're riding to help steer them. And as part of that program, I was able to publish 3 different papers, and I was like, I get to ride horses, I get to do veterinary medicine, I get to improve horses' quality of life. This is what I want to do when I grow up. So at that point, that made me decide that I wanted to do what I needed to do to come back and actually have Dr. Clayton's job. And 22 years later, I was able to successfully do that.
So the DVM-PhD dual degree program is a unique opportunity. Can you walk us through how the program works and what kind of support makes it possible?
Yes. So the program is 5 to 8 years. And so you do your first 2 years of your DVM, or in my case, I did 1 year, just depends. And then you switch over and you do your PhD, and that's 3 to 5 years depending. And then you come back in once your PhD is done and you complete your DVM. And so that's done all at once. And then for what support, we have very generous donors that help support this program. And so while you're in the DVM portion, you do get a tuition stipend. So you do not have to pay for your tuition. And then when you're in the PhD, your PI supports you. And so it makes this career option very affordable for students who are really interested.
Dr. Manfredi, you're known for your passion as a mentor. What do you enjoy most about working with students like Brooke in the dual degree program?
Oh my God, I love the students that I work with and for. But I get so excited and emotional because they're amazing and what really drive me to do what I do every day. Because I had great mentors in Dr. Clayton and others, and so for me, it's the ability to work with them to help shape them to find their passions and facilitate their process of learning about research, about horses, about their professional identity. And so watching them to be able to grow and expand and learn and do things that were scary for them before and do them so much better is so exciting to me. So, for Brooke, I'm lucky that Brooke is so talented and brilliant that I really have just been able to facilitate her progress and watch magic happen. And that's a really unique situation that I can help, again, generate the next generations, who will be me in the future, because equine veterinarians are scarce and equine veterinary researchers are even more scarce. But we really need to do this to help our horses into the future with all the new problems, diseases, and conditions that they're going to be facing. So I've been very fortunate. MSU has wonderful students, and I've been really blessed to have some of the best students come and work with me in my lab.
So to counterbalance that, Brooke, what's it like to train under someone like Dr. Manfredi with her experience and her energy?
Oh, it's amazing. I have so many opportunities that I feel like not all PhD students get. She's lucky enough to do both research and the clinical side of things, so I get to come and watch all the cool clinical cases and get my hands on things. And then for the research side of things, she's just always there for support and for questions at any time of day. And I'm like, I really need help with this thing. She's like, sure, what do you need? And then she also steps back and lets me try things, even when I look at her and tell her, no, I really don't want to do that. She says, no, you can do that. So it is amazing, and I consider myself lucky every day.
So Dr. Manfredi, your research ties directly into the One Health approach. And we'll talk a little bit about what One Health means. Can you share a bit about how your work with horses translates to broader health challenges, including humans?
Sure. So my two research areas of interest are endocrine disease and orthopedic disease. And so in terms of what that means for humans and horses is they both suffer the same kind of condition. So in endocrine disease, it's kind of like a type 2 diabetes situation where we have issues with obesity and then resultant inflammation and changes in how you process fat, glucose, insulin, all of those things. And then with horses for arthritis is a big issue for humans as well as the horses, to be able to just do our daily lives and have a good, kind of quality impact. So most of the work I do looks at some of those interfaces. And so, for example, Brooke already alluded to the study where we said, okay, steroids in some horses would actually be a dangerous combination. And so this is actually something that's been seen in humans too. And so I think in the horse world, we're doing a lot more of biologic therapies or therapies that are derived from our horses' own systems, which I think could play a large role in future in human medicine as well. And so looking at that conversely, in the human world for obesity and type 2 diabetes, there's been drugs that have been designed for that we have now taken into the horse world, and it's shown to have efficacious results there too. So particularly I see that horses can learn from humans and humans can learn from horses, which is a really exciting place to be.
So Brooke, tell us a little bit more about the specific research you do with Dr. Manfredi, especially your focus on arthritis. What questions are you hoping to answer?
So the one that we've been hoping to answer and we're starting to answer is, of course, the steroids effects. And so in the horses with metabolic disease and without. And then additionally, we're doing a little bit more research into the steroids effects within the horse's joints. And so we're looking at metabolites in the joints to see how they change and if they change differently in horses that are normal versus horses that have EMS or equine metabolic disease. And then we're following one more little path that we're looking at subtyping some of our joints. And so in humans, they actually have a subtype of arthritis called metabolic osteoarthritis. And so we're curious if horses might also have this, because as we've mentioned, horses are very similar to humans. And so we're trying to do some subtyping of that.
So either of you could answer this question. What are the biggest challenges and rewards of doing translational research that spans species?
Well, the rewards are now we can impact not just horse health, but human health. And so I know personally most of the dressage riders have arthritis in one or more or multiple joints, as well as their horse compatriots, or horse companions. And so if I can benefit my ability to stay in the saddle longer and more comfortably, that really helps my outlook and welfare, and that can also really help our horses too. So knowing that we could have kind of this, approach that helps now cross species really makes the impact of our research more profound, and also hopefully will generate more and more collaborations between vet med and human med going forward.
So Dr. Manfredi, you're also a Grand Prix level equestrian.
Yeah, and that has really been important for me to really see problems that horses and their riders have, and then how we can address them. So another line of my research now that I've started as the Marianne McPhail Dressage Chair is to look at those horse-rider tack interactions and how we can optimize the combination to really have the best performance for both horses and riders at different levels in dressage. So I've started to look at different tack interactions during different specific movements that we do in upper level dressage. So the Grand Prix level dressage, it is the test that's done at the Olympics. I'm not an Olympic level rider. I'm an adult amateur with a great passion, but it helps give insights into what we would need to succeed as riders, and to have our horses healthy and happy for longer periods of time.
Dr. Manfredi, what was your path to becoming an equine researcher and veterinarian?
So when I was younger, I was involved in Pony Club and had a lot of exposure with veterinarians there and what they did. And so when I went to college, I would volunteer with a lot of different vets at the time, some of them small animal, which proved to me that I really wanted to do equine medicine. But after I went to vet school, I decided that because of my experiences here at Michigan State, that I would want to do both an internship and a residency in surgery and sports medicine, as well as a PhD. And so I kind of set off like a 10-year plan, which is kind of amazing, but it actually came to fruition. And so I did an internship at Mississippi State where I learned about all things with horses, medicine and surgery. I was then able to go to private practice for a while, which I really find valuable because I can see what day one veterinarians experience when they get out and what are really common practical problems that they have to deal with and practical questions they need solved. So I did that in a mixed large animal practice. And then I also worked at some racetracks in Chicago on the regulatory front, looking at how we can keep our horses safe when they go out to perform at high level athletic competitions like racing. After that, I was able to come back to University of Minnesota where I got a surgery residency. And that's where I really did a lot of more work with arthritis and really thought to myself how I could combine my interest in arthritis with endocrine disease that I had an interest in from a very early age. So after that, I did a PhD here at Michigan State in endocrine disease with Dr. Ray Gore, and then finally was able to join the faculty here. So my goal always was to have a board certification so I can actually work with clients, but to have a really strong research background as well, so that I could really kind of go from all levels, from stall side to bench top, to get the best research results that our animals need. Doing your PhD that help you, keep a clinical perspective.
Yes, so I do a lot of extra things, maybe too many extra things. So I work in radiology at night, 2 times a month, and it's mostly small animal stuff, but that's always been very cool because I get to work with some of the orthopedic doctors here, and I get to think of questions that they might even want answered because my research brain is always going. And then I work in the teaching lab, so I get to teach anything horse related like ultrasound or palpation, so that helps me keep some of my clinical skills during my PhD, and again always brings up more questions. And then I have 3 different leadership roles that I hold here. I am the Equine Club Vice President. I am the Integrative Club President, which Integrative Club is anything not really surgery or medicine, so like acupuncture, chiropractic, laser therapy, etc. And then I'm the Chi University Ambassador. And Chi University is where we get acupuncture certified. They're a college in Florida, but we work with them hybrid here. And so all these things tend to just make me think more, and I get to work with clinicians, or I get to listen to talks, and it generates too many ideas probably of what I might want to research. One of my favorite examples is during our Chi University on-site. We learned about this acupuncture technique that goes down the neck, and then you run electro through it, and one of the indications is oh, it moves fat. And of course we're immediately crusty neck horses. How can we move fat in crusty neck horses? And so I actually think the doctor that we were working with, Dr. Munster, might have even reached out to you at that point, and we maybe one day will even run that study. But it keeps my brain clinical, but also questioning.
So crusty neck syndrome is where horses on the top part of their neck, which is called the crest, actually have put down a lot more fat than is desirable. And that fat is kind of bad fat in the sense that it's been shown to have some more inflammatory mediators present in it if it's there. And so for horses that have that, they could be more prone towards equine metabolic syndrome or insulin dysregulation. And so if we could get rid of the fat in that location, perhaps it would make them less at risk for developing laminitis.
How does your research impact your teaching?
So that's one of the great things about my job is I can take my research and then practically help people experience both research as well as important clinical skills in the veterinary curriculum. So a lot of my research is focused on early identification of equine metabolic syndrome or insulin dysregulation issues. And one of the common ways we do that is through an oral sugar test. So this is a test where horses get a great big lug of Caro syrup And so essentially with the Caro syrup, we give it to them and then we measure their insulin 60 and 90 minutes later. And so this is actually something that we've been able to take into our classroom. And so our students actually do a lab where they do just this on our teaching horses, which can give us some data about our teaching horses, about if they actually have this problem, and some of them intermittently do. It lets them see something they would clinically do in real life, and it really shows how we can use the research that has developed some of these testings to be used clinically.
So for anyone listening who's curious about combining research and clinical practice, or considering a path like Brooke's, what would you say to encourage them?
So I would say the biggest thing is reaching out. So if you see a professor that has doing something that you think is super cool and you would like to be involved in, email them, call them, stop by their office, reach out and say, hey, I think this is awesome. Could I be involved in some way? And we are often thrilled to have students that are really that proactive to come and reach out to us. So I think that's the first start, is start that communication chain. Don't be afraid to put yourself out there, because many times that's really how relationships start to form. It definitely happened with Brooke and myself, and it happened with me and some of my other mentors. So, make that first step, and we are more than willing to then take you along on our tremendous research journey. What are your thoughts, Brooke?
I definitely reach out. That's absolutely correct. And then take every opportunity you can. Even if you end up in a lab, maybe doing some research that you weren't as interested in, go for it, see where it takes you. You just never know. Say yes as often as you can. And just be creative and don't be afraid. Reach out and ask questions, and it's completely possible.
Talk about both of your future goals as far as what do you see in the next 5 to 10 years? What do you hope to discover, or where do you hope to be?
I will say my goals change frequently sometimes, because every time I do something new, I love it. But I know I want to work with horses. I need to do both research and clinical work. I mean, truly, my future goal would be to be Dr. Manfredi. I joke, but it's true. Her job is the dream job. But I would very much love to work at MSU, be a clinician, but also get to do my own research. I'm considering doing a board certification. We'll see if I go that route. I would love to get board certified in equine sports medicine, because that is my passion. But I would also still like to explore some clinical practice. So maybe I'll go clinical for a little bit and come back. I will say, being young, you change often, but that's the general direction of my future goals.
I would agree. There's a lot of chances for you to do a lot of different things in vet med, and this is my 7th different kind of job in vet med currently. So I say lucky number 7 might be the one that takes it the rest of the way. But so as kind of a newly appointed Marianne McPhail dressage chair, one of my big focus in the next 5 years is to kind of get going with a few things. So one of them would be really expanding on our understanding of how horses and riders interact together, understanding how what we do impacts the welfare of our horses, and then things that we can do to improve it through time. So a lot of what I'm doing now is a really fun situation. I'm rebuilding the lab, getting a lot of the new technology and equipment that can really best help answer these complicated questions. And so again, for me, it's always going to be something where I want to look at, the final result, horse riders, what are they doing? But then really look at those benchtop clinical molecular level questions to answer what's happening on that level and how we can change that for the better and improve it.
If you could go back to your pre-vet self, so this is before all the degrees, the research, the clinical experience, what advice would you give your pre-vet self, not just about going to veterinary school and your training, but also what the life of a veterinarian is going to be like?
I would tell my pre-vet self to have a little more fun. I think as pre-vets, we get a little too worked up about, we got to get into vet school, we got to get the grades. And I should have maybe played a little harder and rode my horse more often in pre-vet. But I would also tell myself it's possible and you can do it, because I know I had frequent doubts in pre-vet and even a little bit in first year vet school. And just going back and being reassuring, you can do it. You don't have to take it so seriously. Sometimes you can still have some fun. That is what I would tell myself.
I guess what I would say is a little bit similar, but I did actually play. I did ride my horse 5 days a week through pre-vet and vet school, and that you can do that and be successful. I hear so many people, unfortunately, mentor down to students saying you can't possibly be a horseback rider and a veterinarian and a mom and a researcher. And I want to say that it is possible. And is it a teeter-totter? Yes, it's never a complete balance, but it is something that if you have a passion and a willingness to do it, and supportive family and friends around you, that it is something that you can do. And so to keep pursuing your willingness to do all the things that you love and not drop one out because you think it would be too difficult. So it is difficult, but it's worth the troubles.
That wraps up our conversation with Dr. Jane Manfredi and future Dr. Brooke Boger. We hope you enjoyed hearing about their experiences in the field of veterinary medicine and research. If you like this episode, be sure to follow us and share with your friends. And as always, stay connected with the MSU College of Veterinary Medicine for more inspiring stories and insights shaping the future of veterinary care. Thanks for listening, and we'll see you next time.